Hi everyone. We might have heard about the changes that happen after a splenectomy. I've personally found it very difficult to understand, so let's try and simplify what the spleen does. Firstly, in any healthy person, the spleen pools blood elements, specifically the platelets. This makes the spleen a reservoir for platelets and pumps them out during times of need. The second function is quality control of the red blood cells. The spleen is smart. It capitalizes on the fact that the RBCs have a deformable cell membrane and uses that to do two things when they pass through the splenic parenchyma. A. When a normal deformable RBC containing an intracellular inclusion body is encountered, these intracellular inclusion bodies are removed as they are solid and non-deformable. This is called pitting. B. When a non-deformable RBC, be it an old RBC or an RBC with a membrane abnormality is encountered, these deformed cells are removed by the splenic macrophages. This is a process called culling. The third and possibly the most important function of the spleen is the immunological function. Microscopically, the spleen is divided into zones called the pulp systems, the red pulp and the white pulp. In between these two areas, there is something called the marginal zone. This is where the splenic macrophages reside. The splenic macrophages are responsible for something called opsonization of foreign material. Bacteria, especially the capsulated ones, need to be opsonized before the immune cells can recognize and kill them. The spleen also produces antibodies, which is function number 4. And finally, it can also be a site of extramedullary hematopoiesis in the adult when there is a failure in production or increased peripheral destruction of red blood cells. So, after splenectomy, there will be thrombocytosis, a change in the morphology of RBCs and the presence of inclusion bodies in the RBCs, and finally a chance of overwhelming post-splenectomy sepsis by the capsulated bacteria, against which vaccination is mandatory in all surgically asplenic patients. Let me know what these vaccines are in the comments below. This is Surgery Simplified and I'll see you all in the next one.